Welcome back to the 2025 APAICS Health Summit. I'm Madeline Milka, President and CEO of APAICS. Our next Health Summit panel, Mental Health Matters, tackles cultural stigmas that hinder mental health care in our communities. Suicide is the leading cause of death for Asian Americans aged 15 to 24, and Asian American adults are 50% less likely to receive mental health treatment than white adults. This panel will explore solutions for greater access and awareness. Let's now extend a warm welcome to KPAC Executive Member Congresswoman Doris Matsui, who represents the 7th District of California. With a long history of championing healthcare access, Congresswoman Matsui leads efforts to advocate for Medicare, Medicaid, and policies that address the health needs of marginalized communities. She is a key voice in pushing for legislation that reduces health disparities and improves healthcare outcomes for Asian Americans and Native Hawaiian Pacific Islanders, alongside broader efforts to enhance health equity. Please welcome Congresswoman Matsui to this year's Health Summit.
Hi, everyone. It's wonderful to join you today at the APAICS Health Summit. I want to thank Madeline and everyone at APAICS for bringing us together and organizing this event. I'm honored to provide opening remarks for such a timely panel discussion. The past 5 years have been unprecedented. We've had a global pandemic which exacerbated existing mental health challenges. Now it also shed a harsh light on discrimination against AANHPI populations. And that discrimination has only accelerated in recent months. Bolstered by President Trump's rhetoric, anti-Asian hate and crimes against our community have increased. According to Stop AAPI Hate, January 2025 had the highest number of online anti-Asian American incidents since they first began monitoring posts in 2022. The AANHPI community is wide and diverse, consisting of over 25 million individuals of different ethnicities, cultures, religions, and languages. But historically, our community has been treated as a monolith, facing stereotypes and overgeneralizing like the model minority myth. Mental health is often stigmatized and a source of shame in our communities. These stereotypes enforce beliefs that if you are AANHPI, you shouldn't be struggling, and if you are, you shouldn't seek help. Yet nearly all of us have a friend, family member, or loved one who really does live with a mental illness. And that's why I co-lead the AANHPI Mental Health Day resolution with other members of KPAC. I know that to fight stigma, we need to first raise awareness about mental health, a topic that can be taboo. Awareness is the first step to getting effective treatment. But compared to other racial and ethnic groups, Asian Americans are least likely to receive mental health treatment. Meanwhile, even if AANHPIs attempt to seek treatment, they are more likely to face barriers, including lack of insurance, lack of culturally competent care, language accessibility, and immigration status. That's why it is so critical that we expand access to mental health resources. I am proud to have established the Certified Community Behavioral Health Clinic program through my bill, the Excellence in Mental Health Act, which became law in 2014. CCBHCs provide a comprehensive set of services throughout the behavioral health continuum and treat everyone, no matter their insurance status. They can also provide qualified interpreters and translated materials for those with limited English proficiency. Last year, I introduced the Ensuring Excellence in Mental Health Act, which would permanently authorize CCBHCs and allow all states to incorporate this proven model into their behavioral health care systems. I'm also a strong advocate of telehealth, which has increased access to important services. Specifically, I fought to make sure Medicare beneficiaries can access telemental health care without an in-person visit requirement, especially for mental health care. It's critical that we meet patients where they are. And while I'm excited about this progress, I'm also worried about what's at stake with this administration. At a time when we should be investing in mental health, there are instead massive and reckless cuts to critical programs. The $880 billion in proposed cuts to Medicaid would be devastating for not only our community, but for Americans across this nation. Not to mention, there are reports that 1 in 10 staff at the Substance Abuse and Mental Health Services Administration have been fired, with an additional 50 to 70% reduction in staff being considered. SAMHSA employees work hard to bring substance use disorder and mental health treatment services to those who need them the most. These cuts are reckless. I'm fighting back against these cuts, but that's why it's more important than ever that our communities stand together and fight for what matters. Events like this summit are so important for fostering communication and collaboration. We must continue to have these conversations to raise awareness and destigmatize mental health within the AA-NHPI community. Thank you all for being a part of this effort and enjoy the rest of the summit.
I'm pleased to welcome CAPAC freshman representative Congressman Suhas Subramanyam, representing Virginia's 10th district. Before his election to Congress in 2024, Congressman Subramanyam served in the Virginia House of Delegates and the Virginia Senate, becoming the first South Asian American and Hindu elected to the Virginia General Assembly. His work addresses health disparities and the social detriments of health, ensuring that all individuals, especially in diverse communities, have access to the care they need. Let's give him a warm welcome.
Hey, I'm Congressman Suhas Subramanyam. I want to thank you guys for having us and for all that you do. Mental health is such an important issue right now, especially among youth, among teenagers. And one of the things that I've seen is that, in the Asian American community especially, a lot of people don't seek the help that they need because of the stigma or because of cultural norms. And so I think we want to make sure that we are spreading the word about how important it is to seek mental health help, as well as to just, take care of yourselves. And so as a member of Congress, I'm going to pledge to do everything I can to help with mental health and people, especially kids, seeking help. And so I look forward to working with you all, and thank you for all the work that you do.
I'm honored to introduce our moderator, Dr. Christine Catipon, president of the Asian American Psychological Association and staff psychologist at Stanford, a leader in mental health advocacy for AA and NHPI, LGBTQ+, and Filipino communities. She's been featured in PBS NewsHour, the Los Angeles Times, and the Atlantic. Please welcome Dr. Catipon and our panelists.
Thank you, Madeline, for that wonderful introduction to today's panel and the importance of why we are gathered here today. I would like now for our panelists to introduce themselves. We'll start with Michelle Garcia.
Hi, all. I'm Michelle Garcia. I'm the founder and director of Thriving Asians, an organization dedicated to uplifting Asian mental health and leadership. Our work primarily centers on culturally meaningful mental health education. So our curriculum breaks the stigma by integrating shared cultural values into empowering mental health messaging. And we predominantly serve youth with our youth mental health leadership programs, providing training to youth so they can be the advocates and peer supporters in their communities.
Great. Thank you, Michelle. Next, we'll go to Dr. Debra Kawahara, PhD.
Hello, everyone. I'm Dr. Debra Kawahara. I am the 2025 president of the American Psychological Association. The American Psychological Association is the national organization for psychologists, and we have over 170,000 members. Our mission is to benefit society and improve people's lives. And I am also Associate Dean of the California School of Professional Psychology that has graduate programs in psychology and mental health.
Thank you, Debra. Now let's go to Ayesha Meer.
Thank you, Christine. My name's Ayesha Meer. I'm the Executive Director of the Asian Mental Health Collective, and we're a community-based virtual nonprofit with a national scope. But we focus on fostering healing, resilience, and connection in the Asian diaspora across the US. Our main ways in which we do this are through a combination of community-based programming that focuses on building connection alongside funding and increasing access to culturally responsive mental health treatment. We do this through our therapist directory, therapy funds that we have to get people into therapy, and then a range of community-based healing programs.
Wonderful. Thank you so much, Ayesha. Next, we have Dr. Marielle Reataza, MD, MSHPL.
Hi, everyone. Dr. Marielle Reataza here, but you can just refer to me as Marielle. My pronouns are she, sha, and for those of you who don't know, sha is the gender-neutral pronoun in my native language, which is Tagalog. It's the only pronoun we have. So I am a 1.5 generation immigrant from the Philippines. I identify as Filipino Chinese. And I'm also the executive director of the National Asian Pacific American Families Allied for Substance Awareness and Harm Reduction. I know it's very long, so we go by NAPAFASA. And our work is really rooted in using harm reduction principles and practices to prevent, reduce substance misuse, prevalence of that among AA and HPI communities, which are Asian American, Native Hawaiian, and Pacific Islander communities. But this is really a crisis that many Americans are facing. So we're working with really everyone to address what does it mean to be healthy? What does it mean to be mentally well, behaviorally well? And we do this through community leadership, also youth leadership, research, policy change, and civic engagement, as well as local programming such as Healing Through the Arts programming. Thank you for having me.
Thanks, Marielle. And finally, we have Kadisha Tautua'a.
Thank you. Malolole. My name is Kadisha Tautua'a, and I'm the media coordinator for Pacific Islander Health Partnership. We are a health-based organization out of Orange County, and we've been serving our Native and Hawaiian Pacific Islander communities for the past 22 years. Our communities of focus include our Chamorro, Marshallese, Native Hawaiian, Samoan, Tongan, and Fijian communities. Our goal is always to provide health access and resources to our NHPI communities. As a media coordinator, my role is to create accessible content to keep our community informed and supported, and changing the narrative of how we talk about mental health. Thank you.
Thanks, Kadisha. So, as we've mentioned, this panel will explore the importance of mental health and interventions to achieve greater access, given the knowledge that mental health is still widely stigmatized in our AA and HPI communities. So, I'd like to start off by asking, what do you think are some of the challenges of addressing mental health concerns that are specific to the AA and HPI community? Marielle, let's start with you. What have you noticed that are some of the challenges in your work with substance awareness and harm reduction in your community?
So I think there's so many things happening in the AA and HPI communities. I think stigma is a huge part of it. We don't really know how to talk about behavioral health, about addictions, about dependencies, about gambling, for instance. And when we struggle to talk about these things, either among ourselves or among our families, and let's be honest, a lot of us are not honest with our family members about this, it makes it really hard to seek care, to know what kind of care is available, to get the right care. And there's so many factors to it, but I know that the other panelists have so much to share as well.
Thank you, Marielle. Michelle, do you have additional thoughts to add, given your work with the youth?
Yeah, absolutely. Our youth are at risk, but oftentimes youth are really good at hiding their challenges, right? And sometimes these challenges are hidden. It stems oftentimes from the model minority myth, but even sometimes when youth are seeming to be succeeding, for example, in school, that success is not always an indicator of well-being. So interestingly, despite having some of the highest rates of academic achievement, Asian American adolescents have the lowest self-esteem scores among all racial groups. And youth are just dealing with a lot, right? They deal with so much pressure, expectations. It can come from family, but it can also be placed on themselves. And it all piles up, right? The pressure to succeed in school, to take care of family and our household responsibilities, to be a role model, right? Because we're so collectivistic too, and we value, being a good role model to the younger members of our community. A lot of times there's this pressure to save face, right? To be perfect. And there's this feeling that there's just no room for perceived failures or mistakes. And that pressure is also especially experienced by Asian girls and young women. Just with all of this pressure and all of those challenges, this begs the question, who are our youth turning to? And one of the greatest protective factors for a young person's mental health is having at least one trusted adult. And that has to be someone that they can talk to, turn to for support, and not have fear of judgment. And sadly, so often, many AA and HPI youth can't say that they have that one trusted adult. According to a report from Act to Change, given the rise of anti-AA and HPI hate and bullying since the pandemic, 80% of Asian American teens have experienced bullying, but only 38% told an adult, and then only 65% of adults took action. So there's really a big disconnect, right, between Asian youth and parents. And oftentimes it stems from intergenerational, intercultural dissonance at home. Youth aren't comfortable opening up to parents, and parents don't necessarily know how to support the, quote, right way. So in response to this need, we host community listening sessions to hear from youth, what do you need parents and adults to understand? And what we continuously hear is youth really need adults to take the initiative to ask, how are you feeling today? What can I do to support you? To listen without interruption, without jumping to judgment, shame, blame, and also without jumping to solutions. Youth really need the space and actually want to be able to find their own solutions. But more importantly, they really need an adult who they trust, that will listen to them when they need support, and will be supportive when kids say, they want to go to therapy, they want to talk about their mental health, they want to do something to support their well-being. So these are some of the issues, needs that we're hearing from our youth.
Great. Thank you, Michelle. Kadisha, could you share more about some of the specific challenges you see with addressing mental health in NHPI communities?
Talking about mental health is very difficult. One, there's a huge stigma around it. In a lot of our languages, there's not even a translation for stigma. And so when we do bring it up, the words that we use to describe it are words like stress, fatigue, feeling tired. They don't always translate to anything serious. And so instead, people might write that off as laziness or weakness in the community, further pushing the stigma. So if no one tells you that what you're feeling is actually signs of mental distress, how would you know? That's why so many of us stay silent, and we're taught that speaking up about mental health or even acknowledging it is shameful. Two, there's a lack of trust. Even when resources exist, our people don't always use them, and it's not because they don't need them, it's just that there's a deep mistrust that exists. I believe it goes back to our complicated history with the US government and our outside forces, that over time it has taught us that asking for help, especially from outside of the community, it feels like admitting to weakness. So there's just this idea that accepting help, you're somehow less than. And so we've championed this narrative that to endure through hardships, it's like a sign of strength, and to be the strong person, this is what it looks like. So it's altogether, our community is staying silent, even though they perceive these things happening in their body, but we're also not asking help or accepting help. So when we do talk about mental health, these are all the things that we have to talk about. It's all connected and it's extremely sensitive. So if we don't feel safe about talking about this topic, how is it possible for our community to heal? And so that's where we need to start, and just the narrative and the language that we use. Thank you.
Thank you so much, everyone. Those are really interesting insights. We've heard about stigma, but there are so many nuances and layers to what it means to talk about these things. So let's move from challenges to solutions. What do you think are some potential solutions to the challenges that we've mentioned? Ayesha, I'd love to start with you, as Asian Mental Health Collective has tapped into so many unique ways of connecting our community to mental health. What are your thoughts about potential solutions?
On the one hand, we need to be talking more about mental illness, poor mental health, but I really believe that a big opportunity that, the community at large isn't necessarily embracing is the opportunity to explore mental wellness and mental health, not just from a deficit perspective, not just from a perspective of like when you're doing really poorly, but instead thinking about our well-being and our mental health in a holistic way. I think, at Asian Mental Health Collective, our approach is that, we have a vastly diverse Asian diaspora community, and not one single intervention is going to be most appropriate for such a diverse community. And so it takes like a number of different entry points. And so I think getting people access to good quality clinical treatment, getting into therapy, being able to access a psychiatrist or any kind of psychiatric help, those are really, really important. And unfortunately, right now, it's so difficult to do that. Therapists, as you know, Christine, so overburdened. Getting an appointment with a psychiatrist is virtually impossible. We need our community needs the same kinds of access interventions that Americans at large would benefit from. But then I think also many have spoken about how important family and community is for many of our Asian diaspora folks, and finding interventions that combine like connectedness, allow for peer support, social support, like connecting and speaking about mental health within families is going to be crucial. And so my hope is for investment at multiple different entry points. I'm always heartened to be in spaces like this because I think that we have the resources, the know-how, and the experience from within the AA and HPI community to address our own mental health needs. And when we are coming together and designing our own interventions that work for us, we're going to see a much higher success rate and uptake from our community.
Thank you so much, Ayesha. I love that reflection of not coming from a deficit place, but from an empowered place of wellness. So Debra, as the first female AA-NHPI president of the APA, what are your thoughts about addressing the challenges of mental health in our community, given your tremendous influence on mental health practitioners, researchers, and educators across the country?
As I think about kind of the challenges as well as solutions, I think one of the things that we have found is doing a community-based approach. The Asian AA and HPI communities are so diverse, and we get kind of lumped together in terms of being a monolithic group. But we know that within that, there's so many cultures, there's so many language, there's diversity of values, belief systems. And I think it's really important that whenever we're talking about this, we have to take into account that there is much cultural diversity that's where you talked about nuances, and those become important. And that's where a community approach where you can tailor how you're going to address that community and hopefully have the language in order to then be able to talk. But I would say within that community-based approach, relationship. You cannot walk in there and kind of say, I'm the expert, come and see me. They have to know who you are. They have to trust you. And they have to know you're there for the long haul. Like, you're not just going to come in and then just pop in and then leave after you take whatever you want. They have to know that you're committed and you're dedicated to really caring for that community and really helping and supporting them. So that would be one of them. The second, I think that we all can do, and I think, Ayesha, you said it beautifully, health and wellness, educate early and educate often, that we need to build mental health literacy, like letting people know what mental health and that mental health is part of your overall health. Just like you kind of know, what do you feel when you feel good, when you feel healthy, when you feel fit? Well, what is that when you're mentally healthy and you're mentally well and you're mentally fit? I think allowing people to share their stories and their narratives so that it reduces that power that when someone is dealing with a mental disorder or mental illness, it doesn't feel so stigmatized or something is so wrong. Because one of the things we have seen in research is that people wait until it's very, very severe. They may actually go to a physician or a religious person or an indigenous healer, and then instead of going to like a mental health provider. So we need to change that mindset. And then the third thing that I would talk about, funding and resources. We know that we don't have enough of a workforce to address the mental health crisis that we're currently in, but we also don't have the providers to provide the language access as well as being culturally responsive. So I think we also need to address that workforce issue.
Great. Thanks so much, Debra. All right. My next question is, what can our community look forward to or be excited about as we look to the future? Michelle, I'd like to hear from you first. The youth are our future. What are your thoughts?
Yes, there is so much opportunity to shape mentally healthier AA and HPI families, communities, next generation, and the youth, especially youth leadership. They are really the key. So that's why at the forefront of Thriving Asians work is our youth mental health leadership programs. So, providing youth with culturally meaningful mental health education, instilling among the next generation values that will support their mental health and well-being. So teaching them about wellness, teaching them that success can be holistic and inclusive of mental health, teaching them about school work-life balance. We are training and mentoring youth to be the mental health leaders in their communities so that they can be the advocates, educators, supporters to their peers. And we're cultivating the interest among youth to pursue the mental health professions, especially in leadership roles, so that they can be the future clinicians, researchers, policymakers, fill that gap in representation and leadership in the field. And so as we are looking towards the future, we can really be excited about the youth themselves and the change that they're bringing with their generation. They're shaping mentally healthier norms. They're really leading the mental health change. And it's actually already happening now. So I had posed this question to our current student leader team, all of whom are high school, college students that are leading mental health education projects out in their communities or developing youth-led mental health programs. And they really painted this beautiful picture of, what does a hopeful, mentally healthier future look like for us? And so in terms of community change, our youth are really looking forward to a future where mental health is viewed as a part of overall health, where there are more intergenerational conversations about mental health, and where safe spaces are normalized and protected. And so, these are all of the pieces that youth are picturing when they think of a mentally healthier future. Thank you to our students that contributed those responses. And I think us as the adults now, as the stakeholders now, it's up to us to create the resources and the framework so that this future can happen for them.
Thanks so much, Michelle. So, Marielle, I know you and I have shared several community spaces where we've talked about the future of mental health in our community within the current socio-political climate, some of the challenges that we've been facing. What are some things you hope our community can be excited for about the future?
There are definitely a lot of things to be excited about, but I think all of that is grounded in really understanding what the issues are and how we address them. So I want to go back a little bit and address some of the challenges, because we talk a lot about stigma, but we don't necessarily dive deeper into, well, what are the roots of that stigma, right? It sounds like a lot of us on this panel are investing in intergenerational connections because we often live in households where you live with your mom, your dad, your caregivers, your aunties, uncles, grandparents, grandchildren, all in one house. And that's very common for a lot of us. But I think, when we're looking at this, it doesn't mean that we talk about it just because we live together. And one of the things that we've found and what the data support is because immigrants don't necessarily have the same education, especially if you grew up in your mother country. You don't have the same education on the historical civil rights movements that happened across the US that allowed us to have all of these access to rights and services. And another issue that we don't talk about is the fact that many of our parents and those of us who are immigrants ourselves come from countries where the use of drugs is highly illegal, meaning you can die, you can get shot for using drugs or go to jail. There's so many complexities that we're dealing with in that. And when we come to substance use disorder here in the US, well, if historically, right, if you've been caught either using or possessing and the consequence is jail or worse, then that makes it really hard to talk about. I think that one exciting thing, and everyone has already mentioned it, is we're approaching it in new ways with honesty. And I think we have to be honest about not just the fact that we're experiencing these challenges, but that we don't know how to talk about them, but also that there are some of us who use substances. We've have to be honest about that. Harm reduction isn't just about enabling. It's not at all about enabling use. It's about being honest to the point with the fact that some people are going to use substances, and we have to make sure that people have a safe way into recovery or a safe way out, whatever that means, whether that's the administration of naloxone, whether that is peer-to-peer relationships. But we've got to at least be honest. And it's the same thing that we see in reproductive care, reproductive health, right? Abstinence, sure, works for some people, but we know that teenagers and anyone, right, they're going to engage. So how can we address that honestly? And also, I think that, yes, young people are leading it, but also people with lived experiences are leading the charge on what it means to be well. And, it was touched upon before, the way that the mental health and really all of healthcare is designed is to base it on deficits. So instead of saying, hey, you have a mental health condition, hey, you're suffering from this behavioral health condition, therefore you are somehow deficient, how do we turn that narrative around? And I think a lot of us are already doing it, as I'm hearing. How do we turn that narrative around so that we're focusing on, okay, what can we as a society do to support and encourage gifts? And in that way, transform the way that we're looking at wellness and behavioral health altogether.
Great. Thank you, Mario. I think, even just looking at our panel, having the representation to talk about community, to talk about lived experiences, to show that there are people who are representing, their best interests. And, personally, as a psychologist, I enjoy using a little bit of self-disclosure to create that connection that Debra was referring to. So there are a lot of really exciting things, I think, that, if we can communicate those things to the community, like there are people who are passionate about supporting your mental wellness. There's some of us right here, and there are more than us. I think that message is going to go really far. My next question is, how can we make sure our community isn't left behind? I think, as president of AAPA, it's a topic that we often really struggle with, even though we are a very large group, there are many things in psychology that don't always account for our unique experiences and concerns. Debra, I know APA works with mental health professionals across the country from all backgrounds and communities. Can you speak to this topic, especially about what APA has done to ensure that the AANHPI community is not left behind in conversations about mental health?
The APA is doing a lot of advocacy and activism. 2 weeks ago, I went to the Hill to actually advocate for funding for NIH. We have many scientists, and I'm just thinking about some of my friends. Their research on Asian American, Native Hawaiian, Pacific Islanders has been cut, or that they were in the grant process, got approved, and now the funds, they're not even being able to be talking to their program manager. And so we know even before this that Asian American, Native Hawaiian, Pacific Islander scientists and doing that research on those topics were less than 1%. So Marielle talked about not having that research, not having that data. With it being so small, we're not able to disaggregate it because the research just isn't there. The other thing that we know, we went to fight for Medicaid cuts, and we know that Medicaid is a large provider for low-income children, families, adults, and this with the Asian American, Native Hawaiian, Pacific Islander, with it having so much of an immigrant and refugee population, that many of the services, if they cut those funds, the services then can't be provided. And we already know that there's a shortage of services in our communities. So going to fight for that. The third thing that we went to is to continue to fund graduate education in mental health. Again, the shortage of mental health providers, the funding is so important. And I would say advocacy and activism, we need to be visible. We need to represent when we can at the table to talk about these. I mean, I know we talk about allies and alliances, but a lot of times our specific issues aren't voiced, even though we're sitting. So we have to sit at that table. We have to be at the table, and we have to bring these issues up. So that's what I would say. APA is trying to do that, and I'm trying to do that in terms of being in this role, which was one of the reasons I became the APA president.
Thank you so much, Debra. Kadisha, along these lines, how has your work as a media coordinator for the NHPI community helped to bring awareness to supporting mental health and making sure that the NHPI community isn't left behind?
We definitely use culture as a framework to approach mental health when we talk about it, and also as a therapy. So for me, with social media and creating content and resources online, I often think back to Loto Fale, which is essentially the living room or shared family space in any household. It's the most important part of a house because this is where a family comes to pray together, where we feel safe enough to talk about difficult topics. I just often think, if we're sitting in the Loto Fale, what would you say about mental health? And so my goal is always to bring conversations into that space and make it feel safe enough to share with our community and to embrace. Because the truth is, mental health is, or taking care of ourselves, and mental wellness is something that has existed in our cultures for centuries. So it's always been woven into our culture. But then also using culture as a means of therapy has been something that PIP has done. Like I said, our ancestors have so many ways of caring for themselves. And so what that looks like, it might be engaging in activities that are rhythmic and sometimes set in a pattern. So weaving, singing, cultural dance, those are all examples of it. PIP, we've been fortunate enough to host weaving workshops by cultural practitioners. And so there's been conversations of mental health just naturally happen within that space. Using culture as a framework for talking about mental health has been beneficial. Thank you.
Thanks so much, Kadisha. And I really appreciated the reminder that so many of us come from communities where our ancestors have been embodying mental health and mental wellness for generations, even if that wasn't the terminology or anything that, Western psychology might recognize. It's so wonderful to tap back into that generational wisdom. So thank you for reflecting on that. Ayesha, what are your thoughts on looking forward to the future?
I think on this question of not being left behind, I just want to add that, in this space, we're already so great at coming together and working across difference to advocate for the needs of our community. And I would just encourage us to continue to do that, and also to work across other ethnic groups as well. I think that, we have our work cut out for us over the next 4 years with this changing funding environment. And I think we're going to really benefit by coming together with queer communities, with Black communities, Indigenous communities, and Latinx communities, and really advocating across the board for culturally responsive care. And yeah, in doing that, we're gonna build the mental health space and system that so many of us dream of, and I feel excited about that.
Thank you so much, Ayesha. So for us to end on a hopeful and hopefully uplifting note, I'd like to ask each of you, what do you envision when you think of a mentally healthier community / next generation? Michelle, let's start with you.
I envision a community where every person recognizes their power as a role model and as a leader and does their part to support themselves, model that mentally healthy language and behavior, and to support others.
I envision connected and together community that is able to provide care across the board to those of us inside the community as well as outside, and that recognize that our mental health, our mental well-being is interdependent and is kind of predicated on the health and well-being of our communities as a whole.
People are allowed wellness, the opportunity to be able to make choices that systemically and structurally that they're able to have the supports in order to pursue any of their dreams, desires, hopes for the future. That would be what I would want, and that they're able to get care for their well-being and health.
I envision a future where we're going back to our roots, embracing our cultures, but also each other's cultures and learning new ways to care with a cultural lens.
Something else that I think about is how do we create a community that allows for risk taking? And by risk taking, I don't mean, risky activity. I mean, putting yourself out there and being who you are and being safe in that. There's so much power in being able to be who you are and allow people to be themselves in their own right. And when we're all becoming our better selves, our best aligned selves, I personally think that we're also better to other people. And I would love to see a culture that really fosters that kind of self-awareness, alignment, and ability to give to ourselves and to others.
Thank you so much. Thank you to all of you for your work in supporting mental health in the AANHPI community. We look forward to seeing what the future has in store thanks to your efforts and your organizations. And many thanks to APAICS for providing the opportunity for this health summit to take place. Be well, everyone, and thank you.
What a fantastic day of learning and discussion. We've had such valuable insights into the role of data disaggregation and emerging technologies in healthcare, as well as an important conversation on mental health and its impact on our communities. Once again, I want to thank our incredible summit partners at Adalem, Amgen, AstraZeneca, Biogen, Blue Cross Blue Shield, Catholic Health Association of the United States, Compassion and Choices, Pharma, and Planned Parenthood, as well as our speakers, panelists, and moderators for their time and dedication. Please make sure to visit www.apaics.org to learn more about APAICS and our work. Thank you for being a part of this year's Health Summit, and I look forward to continuing these important conversations in the future.